In the news this week, an accelerated FDA approval for a breast cancer drug and a new breakthrough therapy designation for an immunotherapy in non-small cell lung cancer. Also, we will describe President Obama's precision medicine initiative and a new policy statement on electronic nicotine delivery systems. All these stories and more start right now on OncLive News Network. Hello and welcome. I'm Laura Jones. First, this week the FDA granted accelerated approval to palbociclib as a frontline treatment in combination with letrozole for postmenopausal women with ER-positive, HER2-negative metastatic breast cancer. Palbociclib, a potent and selective inhibitor of CDK4 and CDK6, is the first in its class to receive FDA approval. The approval is based on PALOMA-1 open-label Phase 2 data showing a significant improvement in progression-free survival. Dr. Richard Finn from UCLA describes the benefit of this agent.
We're seeing such a significant improvement on PFS from letrozole alone, which has been the standard therapy for this group of women, this class of drug, that the magnitude of benefit is so great, I think it would be very hard not to say this is the new standard of care. Also, importantly, the drug is very well tolerated.
Also in FDA-related news, anti-PD-L1 agent NPDL-3280A has received a breakthrough therapy designation for PD-L1 positive non-small cell lung cancer. In a Phase 1 study, which was originally presented at the 2013 European Cancer Congress, NPDL-3280A demonstrated remarkable and durable responses in patients with metastatic non-small cell lung cancer. Responses were seen in tumors with both squamous and adenocarcinoma histologies. These results prompted FDA's actions. Dr. David Spiegel from Sarah Cannon Research Institute in Nashville describes the research that will feed into the FDA's final decision process.
And then there are efforts, single cohort studies where patients receive NPDL-3280A in PD-L1 positive defined tumors. Actually, two studies were involved in at our center, one called the FIR study, one called the BIRCH study. They're both designed to enroll patients in the first line setting, second and beyond, and even a cohort with CNS metastases. So as the pivotal single arm studies kind of mature and the registrational randomized studies mature for adeno and squamous and unselected patients, hopefully there too we'll have a new way forward in lung cancer.
The NPDL-3280A was previously granted a breakthrough therapy designation in metastatic bladder cancer. The Precision Medicine Initiative is a bold new effort to transform how research and healthcare approach cancer treatment. According to a White House press release, the President's 2016 budget has dedicated a $215 million investment to pioneer a new model of patient-powered research that promises to accelerate biomedical discoveries and provide clinicians with new tools, knowledge, and therapies to select which treatments will work best for which patients. The funds will be dispersed across the National Institutes of Health, National Cancer Institute, the Food and Drug Administration, and the Office of the National Coordinator for Health Information Technology. Each agency will provide expertise and have an integral role in promoting and supporting the basic tenets of the initiative. The initiative promises to advance personalized genotypic cancer treatments in the future. Electronic nicotine delivery systems, including electronic cigarettes, are devices that aerosolize nicotine for inhalation. The use of e-cigarettes and other similar devices is growing in both adult and youth populations. Some consider it an alternative to combustible tobacco, such as traditional cigarettes, while others utilize it as a smoking cessation tool. Many questions remain about the safety of these devices, and studies continue to assess their health effects. The American Association for Cancer Research and the American Society of Clinical Oncology released a joint policy statement. Their key policy recommendations mirror many of those seen with traditional cigarettes, including government regulations, FDA registration, requiring warning labels of products and advertisements, and protecting children and youth by prohibiting targeted marketing. Based on a report in late 2014 in Mortality and Morbidity Weekly, 40 states have laws prohibiting the sale of electronic nicotine delivery systems to minors, and 27 states have them incorporated into their ban in current smoke-free laws.
Tobacco research scholar Dr. Theodore Wagner discusses his views on indoor air laws and e-cigarettes.
I'm of the opinion that e-cigarettes shouldn't be allowed indoors, any place where cigarettes aren't allowed indoors. E-cigarettes is not, what comes out of that is not water vapor. It's been shown that there are carcinogens in the secondhand vapor. There's carcinogens in the third-hand vapor. Again, much lower levels than regular cigarettes, but still they're there. There's nicotine in the secondhand vapor. There's nicotine in the third-hand vapor. Third-hand vapor, by the way, is the residue that gets left on surfaces because nicotine is incredibly sticky, so it sticks on surfaces and stays there. So vaping indoors doesn't somehow clean the air. It only makes the air worse. How much worse, we don't know, but it's not a good thing to have in there. It's not made better by its presence. So anywhere that smoking is not allowed indoors, vaping shouldn't be allowed indoors.
This week, we would like to highlight our OncLive.com peer exchange, updates in ovarian and cervical cancers. Moderated by Dr. Mari Markman, the panel, comprised of expert researchers and clinicians, discuss therapeutic advances in gynecologic malignancies. Topics the panel covers include role of universal screening of BRCA mutations, use of chemotherapy, surgical strategies, and the efficacy of vaccinations. We invite you to view these lively discussions by visiting the site on your screen. And that's the news for this week. I'm Laura Jones. Thanks so much for watching OncLive News Network. We will see you next time.